Dr. Guleria, you're on the government's task force for COVID. Let's put some tough questions to you. The government's accused of wanting to over-centralize, to control the entire vaccination process. Is it fair to say the government didn't scale up manufacturing of vaccines, didn't give approval to Sputnik, Pfizer, Moderna, which have, proven their efficacy after phase 3 clinical trials internationally without insisting on bridging trials over here, as was done, for example, for Bharat Biotech? The full results weren't out, but you gave permission for them to ramp up. And now, when everyone is saying, let's import if we can't manufacture, do you have a plan to import? Because every country is first trying to produce for itself, and the US, where now they're reaching a level where they can start exporting in a few months, but they already have people to export to, and they'll charge rates which India may not be willing to pay.
So that's the point. I think there are two important points. As far as Bharat Biotech is concerned, the studies are already being done in India. As a matter of fact, the largest study of for the vaccine in India was done by Bharat Biotech. Even the AstraZeneca did a bridging study of only 1,600 patients, whereas the Bharat Biotech study has 25,000 patients. So the number is much more, although they had limited phase 3 data when it was given emergency use authorization, although only in a clinical trial mode. As far as vaccine is concerned, a lot of companies had approached the regulators. As far as I know, Pfizer had approached the regulators in the beginning, but they withdrew their application subsequently because the fact that they had got huge orders from outside and they could not supply any more vaccines to countries like India. So we need to see what is the available vaccines internationally, and if they are available, we should try and take them as early as possible. That includes vaccines which are still coming out, like the Johnson's vaccine or others. Sputnik already has been given approval today, so I am very hopeful that in the next few days that will also get added on to the vaccine doses and will help in really ramping up the number of doses that is available. But I still like to stress, vaccine alone will not solve the problem, because vaccine will prevent you from disease. It may not prevent you from infection. The person will still get the infection and spread it to others. So COVID appropriate behavior, preventing crowds, is more important than just the vaccine. The vaccine effect will take a few months. We may take, by that time, if we start having every day 1.5 to 2 lakh cases, we will have a huge challenge as far as the healthcare facility is concerned. We can't have 2 lakh cases every day for the next 1 month. That will really create a huge problem. So we need to aggressively work on COVID appropriate behavior and having no crowds, containment zones.
No,
in the past.
But there do you think, Dr. Trehan, the netas are setting a wrong example when, for example, governments in Uttarakhand don't ban the Kumbh because it's a religious festival, nobody wants to mess with the, the sentiments of people, therefore you say, okay, you have your Shahi Snan and lakhs of people congregate, or as they do at rallies. You're asking all of us to be careful at work, at factories, at workplaces, offices, but look at what's happening out in the elections, or look at what's happening in these religious gatherings. And nobody seems to be having a problem with that. Shouldn't everybody rise and say, for heaven's sakes, don't allow this, because this could turn out to be a very significant super spreader?
Well, the basic thing that you must understand is that we as citizens can only come up with solutions which we have any control over. So first of all, everybody has talked about vaccine. Definitely vaccine is to be ramped up at any cost that we must produce it. 2, the fact again remains, like Dr. Guleria and previous speakers said, that look, vaccine alone is not the solution. It's not a cure. Please understand that. It will help to prevent serious disease. It will help for death, against death. Yes. But unless for the next year or so, we practice safe behavior, we are going to be in serious trouble. Now you're right that these events are super spreaders, most definitely, and people who are attending these rallies are not wearing masks. So we need to enforce it. The private sector, the government, every public institution, we need to we put out on a daily basis, and I must compliment the media that you people have been at it also. Day and night, every channel is actually bringing the message very clearly that life is to be preserved. Yes, it's also said all around that economically it will be disastrous to shut down the country again. So short of that, we should all be realizing our own responsibility at every level, no matter what walk of life you're from. So these two things are the most important things to be given up.